everyone. Welcome to the UNICEF Canada virtual roundtable on wildfires and the impact on children. I really thank you all for joining this important discussion today. And to begin, I would acknowledge that we here in Canada are Indigenous land from coast to coast to coast, with First Nation communities, Métis and Inuit, in all of their diversity, having been here since time immemorial, and reminding us all of their special connection to the land of Mother Earth on this turtle island, and to recall that in our discussions today as we go forward in the spirit of reconciliation. I will also acknowledge that we're joined today by special guests from the United States and from Brazil, also the home to Indigenous peoples, who also have that important connection and stewardship to our Mother Earth. So in connecting today on this important topic, as we think about children, as we think about the Indigenous connection to the 7 generations of children, thinking of the future, let's keep this in mind as we move forward. To begin, I'd like to introduce the President and CEO of UNICEF Canada, Sevaun Palvetzian, for some opening remarks. Over to you, Sevaun.
Thank you so much, Basia, and hello, everyone. I have the deep privilege of being the President and CEO of UNICEF Canada, an organization which for nearly 80 years has been serving the unique needs of children. And as Basia indicated, and the reason we're on this session this afternoon is to talk about the unique impact that wildfires have on children. Today, as we convene, as many as over 300 forest fires that are not intentional are raging across our country. And we know that last week's devastating fire in Jasper, where a third of the structures were either damaged or completely destroyed, means that we have communities all over our country that have seen and will continue to see the impact of what wildfires can do to our lives. But children are unique. Children's bodies are not just little versions of adult bodies. And so as we'll explore this afternoon, the impact of what that toxic smoke does, the impact of what that air pollution is in the lungs and in the developing bodies and in the lives of children is very different. And so we hope that as our continued emphasis on climate change and the impacts that it has on our lives, as that is further pushed with new actions and new policies and renewed commitments from governments of all levels, that children are front and center, and the unique impact and lens that this issue has on wildfires on children's lives is factored in with consideration and deliberation. I'm so thrilled to have you all with us this afternoon. My big thanks to our UNICEF Canada team, to our panelists for bringing your lived experience as well as your expertise, and to all of you for making time for this discussion and making this a priority in your own lives as well, long after the roundtable ends. So with that, I'm going to turn it back over to Basia, who will introduce our panelists. Thank you.
Thank you, Sevaun. And my name is Basia Puszkar. I will be moderating today, and I'm ever so honored to greet a wonderful panel of guest speakers who will share their experiences and their expertise. We have with us Kira Yun, our UNICEF youth advocate, who is 18 years old and joins us from Yellowknife in the Northwest Territories of Canada. Kira is an 18-year-old advocate and who was evacuated due to wildfires last year in Yellowknife. She is a passionate climate activist and a rare disease advocate, and she has written articles and given presentations on wildfires and their impacts in the Northwest Territories. I'm excited to say that this fall, Kira will pursue a Bachelor of Arts and Science at McMaster University, and she has been chosen to be a 2024 Lawrence Scholar to recognize her community contributions and aspirations for meaningful change. So congratulations, first of all, from all of us, Kira. We are also joined by Brian Wiens, who is the Managing Director of Canada Wildfire. Brian has a distinguished career with the Canadian federal government and has worked across various regions in Canada. He began as an operational meteorologist before transitioning to air quality programs, where he contributed to the development of the Air Quality Health Index forecasting and reporting system. In 2020, he became the Managing Director of Canada Wildfire, and there he focuses on the organization's 4 pillars on partnership, training, research, and knowledge exchange, and administering the Canada Wildfire and Strategic Region Research Network. Additionally, we are joined by Luciana Phebo from Brazil with UNICEF there, where Luciana is the head of health and nutrition in UNICEF's Brazil office. Throughout her career, Luciana has focused on expertise on advocating for the rights of vulnerable children. Prior to joining UNICEF, she worked at the Rio de Janeiro Municipal and State Secretaries of Health as a researcher and social activist in health and violence in Viva Rio. She is a pediatrician with an MSc in public health from Johns Hopkins School of Public Health and a specialization in international health and epidemiology at the CDC. And finally, Swathi Manchikanti, who really led the development of the UNICEF report on safe from wildfire smoke and is a climate adaptation and health expert working at UNICEF Global. She focuses there on the impact of climate change on children. And throughout her career in the Middle East, Southern Africa, and South Asia, she has implemented interventions to improve community resilience. She was, as I said, the lead author on UNICEF's technical note on protecting children from heat stress and wildfire smoke, and she looks to synthesize the latest evidence on child-specific health outcomes. So thank you all for joining us today for this important discussion. And to start, as UNICEF Canada, we are here to advocate for children, but also to advocate for youth voice. So we would like to start with that youth voice by turning to Kira. And Kira, I wonder if you could take a few moments to talk to us all about your experience with the evacuation from Yellowknife last year and what that was like for you.
For sure. Thanks so much, Basia. It's really great to be here today. So on the evening of August 16th, last summer in 2023, an unprecedented evacuation order was called for the city of Yellowknife, which is the capital of the Northwest Territories and home to upwards of 20,000 people, including myself. It didn't come as a complete shock. There had been rumors circulating for a few hours, and the fire had been approaching the city for a few days, few weeks. And at this point, it was just 15 kilometers or 10-minute drive from home. So with about 36 hours to evacuate, grocery shelves were picked clean and lines to get gas were hours long. My family spent the evening scrambling to pack up and debating over which photo books and keepsakes we could fit into the car. But pretty quickly, stories of car accidents and stressed drivers who became reckless began to circulate. So my family made the decision to drive out the following morning at 4 a.m. Our plans shifted slightly when my mom found out she would need to stay back to help evacuate the territorial hospital. But in the end, I think it was actually a bit of a silver lining because it meant we could fit a little bit more in the car, which proved to be very helpful for my family's 3-week evacuation. Driving out on the only one-lane highway from Yellowknife, we had to wear N95s because of how thick the smoke was, and we passed by the fire that was threatening our city on the side of the road and stretches of forest that were burnt to the ground just as far as the eye could see. And we also passed by the hamlet of Enterprise, which was essentially burnt to the ground. So we passed by the charred skeletons of vehicles and the caved-in roofs of burnt houses, and it was just absolutely surreal. So after driving about 20 hours, over 1,000 kilometers, we made it to Edmonton, and I consider myself extremely lucky to have had a vehicle to evacuate in and a place to go in Alberta, because this wasn't the case for a significant proportion of the 70% of the Northwest Territories that was evacuated throughout the summer of 2023. Many evacuees were forced to wait in lines for hours to get on evacuation flights on which they could only bring one carry-on. Once the acute threat of the approaching wildfire in Yellowknife had been avoided, many evacuees in Alberta and other provinces faced really unforeseen and trying circumstances. So, for example, many unhoused people found themselves on the streets of unfamiliar cities, scattered across Western Canada and away from their regular supports, and with no way for the NGOs who had been supporting them in the NWT to find them. I've heard really harrowing stories of people who were robbed, evicted, or otherwise. And in fact, a study by researchers at the World Health Organization pretty recently shows that domestic violence actually increases during emergency situations such as wildfire evacuations, because there often aren't safeguarding frameworks in place to protect the most vulnerable in times of crisis. And I think this is a really excellent microcosm of what I observed during my evacuation experience, a situation where the physical threat of the wildfire was very well managed, but the socioeconomic impacts of the crisis were often overlooked And this was especially challenging for more vulnerable populations, and that includes kids. So among many challenges, one that I observed and experienced the most frequently was the impact on mental health that the evacuation and wildfires in general have. So after a summer last year where sports practices and camps for kids were canceled across Yellowknife, being so far displaced from home, away from regular routine, friends, family, extracurriculars, school, whatever it be, it took a really big toll on a lot of young people. And amidst an active crisis, it can be especially hard for young people to know how to find and access appropriate resources. A recent report on the Yellowknife evacuation last summer actually highlights that only 2% of survey respondents had access to information about mental health resources, which is just absolutely appalling to me. And I myself, as a runner and a paddler, had a really hard time being stuck inside for the better part of the whole summer, knowing that going outside would be jeopardizing my physical health, but staying inside was taking a toll on my mental health. More broadly speaking, the increasing prevalence of adverse climate events such as wildfires is such a tangible and frankly terrifying manifestation of global warming that is understandably heightening fears and anxiety about the future of our communities and our planet amongst myself and my peers. The challenges presented by wildfires are profound and destructive and really deeply intertwined with many systemic social problems that already exist. And I'm glad I got to touch on just a couple that I experienced and observed last summer during my evacuation. But there are many, many more challenges, many of which I'm sure will only really come to manifest themselves more substantially in the seasons to come as wildfires get worse and worse. The unfortunate reality is that while kids are the least liable for climate change, they're now the ones who feel its impacts the most strongly, including in terms of wildfires and their repercussions. So I'll pass it back to Basia now.
Great. Kira, thank you so much for sharing a little bit about your observations. That's really important for us to hear. Swathi, if we could turn to you now. You led the development of the recent report that came from UNICEF called Safe from Wildfire Smoke. And I'm wondering if perhaps you could review some of the key findings from that report on the impact of wildfire smoke on children.
Hi, Sevaun. Yes, definitely. Thank you. But firstly, I do want to thank you, Kira, for joining us today and for sharing your story. It cannot be easy to recollect such a traumatic experience. And I think it's easy for me to be here and share what's happening from an academic perspective, but I don't think it'll ever convey the nuances and complexities of that lived experience that you just shared. So thank you for sharing with us that. That being said, I can try to build upon, what Kira mentioned in terms of health outcomes. At UNICEF, as you've mentioned, we've completed a major review earlier this year, which aims to summarize what we know so far about how wildfires, and particularly wildfire smoke, affect children and adolescents globally. And what we learned basically further reinforced to us that at the heart of the planetary crisis is a children's crisis or child health crisis. And this is because children are not little adults, like Sevaun said, or I think Basia said earlier, and they have unique vulnerabilities that shape how they're affected by the climate hazards that they experience. So for instance, this includes children, young children particularly, breathing twice as fast as adults when they're young, and their lungs are developing, which means that they could potentially breathe in more pollutants in the air. In addition, they have child-specific behaviors like putting objects in their mouth, especially when they're infants and toddlers, and this can be dangerous when they're in contaminated or polluted areas. And then also, they're still developing many of their systems, their immune, hormonal, nervous systems, and this all leaves them more susceptible to contracting infections caused by the pollutants or toxins that they're breathing in, while at the same time, it leaves them at a higher risk of having these toxins shape how their body develops going forward as well. So, when it comes to the health impacts themselves, a recent study that was, I think, widely cited has found that wildfire smoke, for instance, can be at least 10 times more toxic than ambient air pollution alone, especially in children under 5 years of age. And this is in part because of the vulnerabilities that I've just shared, but also because wildfire smoke has significantly higher amounts of heavy metals and toxic metals than regular air pollution. And so then, kids are inhaling much more of that when they're exposed to wildfire smoke. And this is important also to know because I think when we picture wildfires, we picture physical injuries, immediate death, damage to houses, which is all very concerning and important. But also wildfires impacts are much larger due to the wildfire smoke that is generated. And the smoke itself is associated with hundreds of thousands of chronic health events and premature deaths every year. There was a 2020 study that was done, which basically found that if you are living in an area where there's a wildfire happening or a wildfire just happened and there's smoke all around, if you go outside in that environment, let's say that the air quality index says it's about 150 outside, so pretty unhealthy. But if you spend the entire day out there, in just that one day, it's equivalent to you smoking 7 cigarettes. I mean, that's how toxic wildfires can be. Now, if we talk about specific health outcomes for specific demographics, when pregnant women are exposed to wildfire smoke, they're more likely to experience chronic health issues themselves, like gestational diabetes, gestational hypertension, things that are very strongly already associated with exposure to air pollution. But they're also likely to experience preterm birth, low birth weight, stillbirth. And that's in part because of their own physiological changes during pregnancy. They're also just, have increased respiration. On the flip side, if a child has been exposed to wildfire smoke in utero before birth, they've been found to be more vulnerable to infections and diseases after birth as well. And they're also more likely to develop chronic illnesses, diseases like asthma in childhood. So they're born more vulnerable. Another study that was looking at children under 5 across 48 low and middle income countries found that particulate matter from fires was more strongly associated with infections, respiratory infections, than particulate matter from other sources of air pollution. And other studies have also found that, particulate matter from fires can lead to more hospitalizations of children for respiratory illnesses, up to 30% more compared to ambient air pollution. We also know that exposure to wildfire smoke has been associated with impaired cognitive development, poor sleep quality, mental stress. Kira spoke about, increased instances of violence. So this is also associated. And also, echoing her experience in Canada, I think everyone in Canada might be familiar with the infamous Fort McMurray wildfire and all the studies that have been published after that. They found that even 18 months after that wildfire occurred, about 27 to 37% of children and adolescents basically demonstrated having post-traumatic stress disorder after being exposed. So all this to say, and also I think they found higher scores on measures of depression, anxiety, and substance abuse in adolescents, as Kira also, I think, rightfully mentioned. So as we speak, there's more and more research coming out about this topic and how also compounding climate hazards can have worse health outcomes for children. For instance, researchers are now asking, what does it mean to have a wildfire and extreme heat and drought happening at the same time? So this field is evolving, and it's important for us to stay on top of the literature to enable the most impactful action. But I just want to end by saying that the most important thing to remember is that wildfire smoke is many times more harmful to children's lungs than regular air pollution. And because of children's unique vulnerabilities, it is that much more damaging to their health than we've ever known before. Thank you.
Swathi, thank you so much for giving us an overview of that important research. And I see in the chat that we have some important links for people who would like to know more. To zoom in on the international perspective, Luciana, could we turn to you? Particularly, we're interested because Brazil is home to the Amazon, the lungs of the earth, and we know that this has been a very particular issue there. And of course, you bring particular expertise on children's health. Could you maybe describe the impact of wildfires in Brazil and the specific impact to children there?
Sure, Basia. Thank you for the invitation. And I also thank Kira to share with us her personal experience. This is very important for all of us, Kira. Thank you very much. I have a presentation, so I'm going to switch to my presentation. Is that okay? Can you please tell me if you can see, Basia?
Yes, we see it well, Luciana.
Good. So I'm going to present fire, smoke, and drought in the Amazon state, and also the mitigation actions that we do here in Brazil towards climate change. It's not going. Not going. Yes. So the first part, I'm going to talk about the situation in the Amazon state. In the second block, I'm going to present what UNICEF Brazil is doing in response of climate change. The Amazon state, it is located in the north part of Brazil, and it is the largest state in Brazil, but with only 1.9% of Brazil population. That means Several people live in remote areas that we can reach only through the rivers. And during the dry seasons, the rivers are blocked. We cannot reach those people. Even basic supply cannot reach them. And I'm talking about food, I'm talking about medicine, about vaccines. This is life-threatening supplies. And more than that, the north region of Brazil is the most poor area with the lowest social economic status. Just to give an example, the under 5 child mortality in the Amazon state is much, it's above the entire country, as you can see from the data at the last line here. Drought is a main factor in how large fires start and spread in the Amazon, even though many fires are started intentionally, criminally, by human action. We know that climate change plays an important role on that. The El Niño plays an important role on reduction of the rain, but also the increase of global temperature plays an important role on hotspot and then on fire. And as you can see on the smoke, as you can see from this photo from Manaus, the capital city of the Amazon. To give you an idea on numbers, in 2023, out of the 62 municipalities in this state, 6 municipalities were in emergency status, and 2 municipalities had alert due to the intense drought. More than almost 100,000 people were affected, and most of them come from the most vulnerable communities. Almost 20,000 hotspots occur during this year until October, and almost 2,600 firefight activity happened during only 3 months and a half, from July to October. It was a very severe situation last year, and this year happens to be the same. We already have some municipality under emergency situation in the state of the Amazons. We know that the drought and fire impact highly vulnerable population disproportionately. This is very important. We are talking about here indigenous people, river and traditional communities, the most vulnerable population in this area. And they are most vulnerable on this kind of emergency because they really depend on local food production, on the availability of fresh water, on the access of goods, as I just said. And they are more sensitive to all these climate changes. But at the same time, indigenous communities, they are the most effective actors resisting to those practices. Indigenous territories are much more likely to protect from deforestation. And for sure, indigenous communities can withstand longer and more severe droughts. We know that indigenous communities are critical for the protection of the rainforest, as you say, the main lung of the world. And we really thank for the indigenous communities to be there and protect the Amazon. This is a very important map. You can visualize what I just said, because this map shows how important the indigenous territories and conservation units, they are in this map on gray area. You can see how they can stop fire and deforestation in the region. You can visually see what I just said from this map. Not best. Just a second. Okay. When we talk about hotspot, it increased immensely in 2023. As you can see, comparing to the previous years, more than double the number of hotspots in this state, in the Amazon state. And the hotspot is very linked to what we are talking about, fires or wildfires. And when we talk about the quality of air, my colleague just mentioned how severe it is when you have an index of quality of air above 100. In September of 2023, in Manaus, capital of the state, several days in September, children inhaled the air with a quality above 100. And even worse, in October, as you can see, the AQI reached almost 400, which is the most severe level of quality of air. So this is what happened in the Amazon, and it still happen, and it will happen again, and again, if we don't really work preventing the roots of this problem. And I'm talking about climate change. I'm not going further, but I'm so glad to be here sharing this panel with Kira, because we know that all of us have to work together, and have to work together with the young generation as well. Thank you very much. I will continue in the next block.
Luciana, thank you so much. This is so interesting to us to see the Brazil experience. And indeed, in the comments, I see a request for your slides if you're willing to share after the presentation.
Sure.
Thank you for that. Brian, let's go over to you now. You know, in Canada, forests are so important, nature is so important, and right now it's very much on the minds of people, and indeed many Canadians are living with the direct impacts and are displaced due to the fires in Jasper, which is also near and dear to our hearts as a national park that we all adore. If you could give, as your role as Director of Wildfire Canada, your view on key considerations regarding the increase of wildfires in Canada and what we're seeing now.
Certainly, thank you very much. I'm assuming my voice is working, or at least my mic is. So,
indeed, we see your video, we hear your voice, okay, and we see your presentation.
Awesome. Thank you very much. Thank you to Kira and Swathi and Luciana for that nice context. It's very easy to forget that some of the impacts of fire go way beyond the initial evacuation. We hear everyone got out safely, and it's easy to forget that those impacts last for weeks, months, and years afterwards. And so I think that context from both a personal experience, the health, and sort of the whole broader picture is absolutely critical and important. One of the big challenges with fire, and particularly in Canada, is we live, for the most part, in an ecosystem that's fire adapted, which means that fire is an inherent part of that ecosystem. And in fact, if we go back into the long history, not only has it been part of the natural ecosystem, it's also been a significant part of Indigenous practice to actually work with fire and use it as a tool in their lives and in the way they interacted with the environment. But what we're seeing happening now, of course, is that with climate change, we're seeing a significant increase and in terms of the number of fires, but also a change in the character of fires. Just to give a really quick snapshot here, and I'm not going to go into great detail here, but I think it's important to realize that in Canada, there's kind of a mix. About half our fires, a little bit less than half our fires, are lightning caused, and those tend to be fairly remote, fairly far away. But as we know very well, that smoke travels great distances. And so it isn't like you're ever particularly safe from it. And so we've had a number of instances over the last number of years where locations very, very distant from the fire experience extremely high smoke levels. And so smoke goes way beyond the initial impact of the fire. And in fact, smoke is one of the big drivers that actually creates the motivates or actually causes people to evacuate. And I think there's a couple points I really want to make about that, is that under a situation of climate change, we're all somewhat aware, but I think it's worth reiterating that we actually have longer fire seasons. We actually start thinking about fire much earlier now than we used to, say 30, 40, 50 years ago. In a warmer climate, we have much more drying potential. So there's the possibility of the fuels to become drier faster. The other thing that happens, and we're seeing a trend this way too, is that lightning is becoming more frequent, and particularly areas that are prone to having naturally ignited fires, then you actually have a chance for even more of those. And I think it's worth noting even right now that even what we call human-caused fires, some of those are not negligence. They aren't people throwing matches or pushing a burning car into a ravine. They're the activities that we participate in. Sometimes it's just inadvertently driving through the woods with a vehicle, or it sparks off of a chain or something like that on a trailer. The other thing that happens is that we're seeing very different weather cycles, and that shows up in terms of extended periods of extremely hot weather. We're seeing extended periods of drought. And the irony is that we're also seeing more floods. So climate change creates this big contrast in a lot of ways of what's happening. But even on a day-to-day basis, we're noticing more and more fire behavior that doesn't settle down, doesn't slow down in the evening because it's not cooling quite as much as it used to. And so there's quite a bit of experience where we have significant fires running overnight. And the other thing sort of started at this, but fire and society interactions are increasing. We have more people who are active in the lands, in the what we call the wildland urban interface, people living there. We have industry, we have power lines, roads, all those other kinds of things. But with smoke becoming more common and, of course, traveling great distances, we're seeing that starting to interact with an awful lot of different places. And one of the most obvious places that smoke impacts is, in fact, in evacuations. And evacuations are, at least initially, usually caused by the impact of smoke. People need to get out of there. They take particularly the vulnerable populations out of a community as early as possible to minimize that exposure to smoke. But then sometimes, of course, as we've seen in Jasper and other communities, people have a direct threat from the fire as well. And what we're seeing in this particular map, and I think it's worth noting that there are certain communities, particularly in Canada, who are disproportionately affected, and that's communities that have a majority Indigenous population. Part of that is where those communities tend to be located, but it certainly is a community communities in Canada that suffer a much higher frequency per capita of evacuations, and of course the attendant challenges that come with that. Beyond that, I don't think I'm going to say really very much more than that. One of the challenges that we have to figure out in terms of responding to fire is the smoke is becoming more and more an issue. We've thought about fire just in terms of the direct impact, the lost timber, the impact on communities, the impact on infrastructure. But now we're really starting to recognize how big that impact of smoke is. And I think it's particularly timely to link that into how big an impact that has even within society, where children, again, are disproportionately affected by smoke. Thanks.
Indeed. Thank you so much, Brian. That's really helpful and interesting. We've just had some time to hear from our speakers about some of the challenges. And before we move on to what some of the solutions are in our second part, I'd like to highlight two important reports. Links are available in the chat for anyone who would like to go more into detail. The first that I referenced was the report led by Swathi, and that is the UNICEF report on wildfire smoke specifically. There is also another newly released report called A Threat to Progress, Confronting the Effects of Climate Change, that is available for reference there. So I do commend those reports to anyone who's interested. Looking over these important challenges, let's look at some of the solutions. And again, let's start with the youth voice with Kira. As a youth advocate, Kira, and with your direct experience, knowing that your life going forward is going to be impacted by climate change, and particularly with wildfires, the frequency and intensity is expected to increase. What do you think is most important to you as we think about climate change solutions and action going forward?
Thanks, Basia. So last summer when I had to evacuate, one of my biggest takeaways was that wildfires just have an incredible breadth of impact, and the repercussions that they can have are often so much more than what initially meet the eye and what you might think. So that's why I think that finding sustainable and effective solutions to the challenges presented to youth by wildfires need to lie in finding comprehensive and really holistic strategies that address every facet of the crisis. So I'm going to touch on 3 key points in the next few minutes based on my own personal experience with wildfires and the insights that I've derived from that. So I'm going to talk about investment in research, addressing the root cause, and foresight and contingency planning. So first off, to open my little spiel about research, I'm going to tell my own little story. So I'm currently working at the Institute for Circumpolar Health Research in Yellowknife as a summer student. And currently, I'm working on a project where I'm reading all kinds of articles and reports from the evacuations across the Northwest Territories last summer. And they're all retrospectively discussing the evacuation and the impacts that it had on communities across the territory. And it's been super, super eye-opening to learn about the breadth and the depth of the impact of these wildfires on my community, be it in terms of supply chains, education, domestic violence, just to name a few. So this project has really solidified in me the urgent need for rigorous and holistic research that needs to be done to identify the key priorities to protect young people and older people alike, because the impacts of wildfires are really profound. And I believe that good research is the foundation of good solutions for the inevitable challenges presented by wildfires to kids whether that be in terms of health impacts, evacuations and their fallouts, socioeconomic impacts, or anything else. I believe that we owe it to the upcoming generation of kids to have robust solutions and adaptations to wildfires that are informed by innovative and thorough research. But this all goes without saying that we need to actually address the root cause of all of the unusual and scary wildfire behavior that we're seeing. So reducing our carbon emissions to keep global temperatures below 1.5 degrees Celsius above pre-industrial levels is a critical step in addressing long-term the impacts of wildfires on kids, because otherwise we're just going to keep seeing the same challenges that we're seeing now, getting worse and worse and less manageable with Band-Aid fixes. And circling back to the mental health piece that I was discussing briefly earlier, speaking from my own personal experience and my observations, the stress and the burden of an unclear future for my planet and for my community can be dampened a little bit by conventional resources, but the psychological challenges that are becoming increasingly prevalent amongst youth as adverse climate events become more and more widespread and more destructive can only really be addressed by reducing our emissions and transitioning to a green economy and a green society that actually promises a clean future for ourselves and for every generation to come. That being said, progress is going to be incremental in terms of decreasing emissions, and wildfires, as Brian mentioned, always have been and likely always will be a natural and vital phenomenon. So I believe that there needs to be substantial contingency planning and resource development for kids and people who aren't kids affected by wildfires, because although we unfortunately can't predict wildfire trends and behaviors, we're getting more and more insight into how to equip kids and their families with the tools to keep themselves safe and healthy. So to give a few specific examples, that could mean subsidizing air purification systems, making mental health resources that are tailored to eco-anxiety and wildfire-related stress accessible, and disseminating information on staying safe during wildfire seasons are just a few key steps that can be taken to ease the burden of wildfires on kids and their families alike. So although it's unfortunate that I've had such a personal experience with wildfires, I'm also really grateful that that experience has given me a voice to advocate for the increasing number of youth around the world who are facing really unprecedented challenges because of wildfires. And I'm hopeful now that we're reaching a time when more and more resources are going to be invested into adapting to increasingly frequent and increasingly destructive adverse natural phenomena like wildfires. But I'm also hopeful that the loss of life and land that's happening around the world as a result of wildfires is going to be a driver for change and a source of motivation to drastically cut our carbon emissions going forward. And I'll pass it back to Basia.
Sure, thank you. Those are really useful insights. I really appreciate that so much. Swathi, perhaps we can pass the baton to you. And I'm wondering, from all of your research and leadership in this area, particularly with the report on wildfire smoke, for two things. What do you think is most important for parents and caregivers to be thinking about? But also, what is important for policymakers? And I know I have in mind COP29 in November in Azerbaijan, where climate leaders and signatories to the Paris Agreement are coming together. In that macro scale, is there anything that you would like to share as a message?
Thanks, Basia. And I just want to say Kira already took all my ideas. So everything that we're about to share is just going to sound like a repeat of what Kira already expressed. And I think, yeah, we're all kind of agreed on what the key actions are. But let me start from the beginning. So firstly, it's important for caregivers to recognize the most troubling signs and symptoms of wildfire smoke exposure in children. So this could include chest pains, trouble breathing, wheezing, coughing, irritation of eyes, nose, and throat, dizziness, and particularly if the child is having trouble breathing, please take them to the healthcare facility immediately. So it's important to just become familiar with the signs and symptoms and make sure that you're always checking in on the children. In the technical note itself, we've identified, I think, 10 actions for caregivers globally. So we've tried to find actions that I think are adaptive globally and not just to, maybe Western settings. But, 10 tips, 10 actions that they can do before, during, and after wildfire events. And this could be everything from preparing an emergency kit with child-friendly N95 masks to having an evacuation plan ready, to making sure that children are not doing any sort of cleanup work when you return back home, and also minimizing activities for the short term that can add to air pollution, like cleaning with gas, burning waste, smoking, things like that inside the house. I do want to reemphasize the importance of having an emergency kit and plan in place. It seems like, Kira, your family was able to get together the most important things in time. And so that is really the most important, and it can make a huge difference if it's packed properly. I just want to say at my house, my dad has like a file folder with all the important paperwork of our household, and he tells us fire, rainstorm, hailstorm, whatever, that's the first thing that needs to leave the house. And so that's the soul of our emergency kit. And we're all made to orient on that every year as well. So in addition to caregivers being more prepared, health facilities and schools also in high-risk areas need to double down on preparing for action. So they should be connected to, early warning systems. So this is, just making sure you're checking in with the Weather Channel, or maybe there's like a national alert system that you get messages from that can help trigger emergency response and evacuation protocols. During and after wildfire, healthcare facilities just need to be prepared to manage the increased admission of patients due to respiratory infections in the short and long term. So this includes, preparing medical supply stocks, implementing proper triaging practices so you can really quickly identify which patient needs the most help the fastest, as well as offering supportive services such as psychological aid for mental health needs in affected children. And ideally, this psychological aid can also work with the caregivers and train them on how to identify mental health needs in their children as well. Schools should also follow the same practices in preparing necessary supplies and providing resources for coping, but also ensure that they're regularly tracking air quality notifications during wildfire seasons in their respective areas. And then when the fire has passed, they should also have procedures for cleaning up the school areas before the children actually return. And finally, when it comes to addressing wildfires and their impacts on health at the national level, policymakers should really invest in their investments in mitigating the risk of wildfires in the first place. So I think following a lot of advice that Brian is probably about to share, and concurrently build climate resilient communities at the local level. But to build resilience at a local level, policymakers need to leverage national and international cooperation frameworks to improve fire management, because we all know that wildfires do not respect political borders. Ultimately, though, we need stronger climate action to protect children, not just from wildfire smoke, but all climate-related hazards such as extreme heat and droughts. And these can all concurrently happen, as Luciana had previously just presented to us. So at COP29, UNICEF, I think, will be advocating for like the following 3 broad sets of actions to policymakers globally. And these can also be found in that climate change report that was linked by Lynn in the chat. So firstly, this is very obvious and something Kira has highlighted very clearly. We still have a chance to reduce emissions to meet the 1.5 degrees Celsius goal. And we should do that by prioritizing mitigation efforts that have clear child co-benefits, like expanding green education, green infrastructure, and decarbonization technologies. Secondly, we need to protect children now from the impacts of climate change through adaptation efforts. We can't wait for mitigation to do the job for us. And so we need to do this by scaling up We need to do this by scaling up adaptation, and to do that, we need to ensure that climate policies meet the needs of children exposed to present climate hazards. So this could be everything from helping caregivers better understand what symptoms look like and how they can protect children at the home, governments investing in multi-hazard early warning systems, helping orient community health workers and health providers on emerging diseases that are climate sensitive, like heat-related illnesses. And also, just as importantly, we need to strengthen climate resilient primary healthcare to ensure continuity of essential maternal, newborn, child, adolescent health and nutrition services as well, particularly in low and middle income countries. And then finally, the third recommendation is to prioritize child health and well-being and climate investments and action. We're all talking about children and child health here, but there are still many research gaps that remain, and the child health is not necessarily monitored as well as it can be monitored in national frameworks. So we need to prioritize child-focused vulnerability assessments, just generate more local data, address gaps in research. There's a lot of wildfire research in high-income countries, but so little in low and middle-income countries, and we need to really spread the wealth when it comes to that. And we need to foster multi-stakeholder collaboration in the area of children's environmental health holistically, which includes working on wildfires. The bottom line, though, is that preparedness is key in all sectors. We all know this. But as we're preparing, we need to make sure that we're focused on the child, because if you can help the child, then everyone can be helped. And yeah, and preparedness is also important because it's also harder to think in the midst of a disaster. Yeah, thank you.
Good. Swathi, thank you so much. Wonderful tips. And I'll just commend to everyone links in the chat. One is from UNICEF Canada, Wildfire Safety Tips for Parents and Caregivers, which does reiterate some of the wonderful tips that Swathi shared. And I noticed that our colleague from Save the Children has also shared their wildfire safety tips too. So for more information, please look there. Let's turn back to Luciana from Brazil and talk about some of the key actions taken to protect children, key actions to protect the Amazon, and what you would like to see going forward in terms of action on climate change and wildfire safety.
Thank you. Let's continue my presentation. Can you see? Are you able to see?
Mm-hmm. Not in presentation mode, so.
Not now?
Yes, now.
Okay, good. So let's see what we are doing here in Brazil. But before talking about fire, we have to think about the precondition situation from the Amazon children. And usually we have to face conditions like malnutrition, like infectious disease, like lack of drinking water. And when we have such an emergency with drought or with fire, these conditions are even worse. So our first step is to do a rapid assessment of maternal and child health nutrition service, how they are dealing, how they are responding to the situation, and also do the assessment on children, not only in health, but also on nutrition. Remember that we cannot reach those kids. We cannot send food, supplies, anything. So it's very, very difficult. We live very difficult situation. So most of the time we have to provide supplied nutrients to treat severe malnutrition, but always with the government, with the Brazilian government. We develop specific protocols because this is very important. Any emergency, we have to treat as a unique emergency with different aspects to deal with specific case management. But not only on health or nutrition, we also have to think about the access of drinking water. And our problem here is on acute diarrhea in children, very frequent in any kind of emergency. So we make sure that families from remote areas have access to drinking water for not only for children, but for the whole family. But talking what Kira told us, and also Swathi, we count on youth network, youth indigenous communicators. And with them and for them, we engage them to collect information about their community, to understand as an assessment as well, to understand the situation. And with them and for them, we raise alerts, we share key messages such as on mental health, as Kira told us many times how important it is to deal with mental health at this moment, but also on different aspects such as school closing. We try to avoid school evasion on this situation when they return from an emergency situation. Many times, less kids go back to school. So it's very important to keep school open when it's possible. But also on violence prevention. This is very frequent, not only at home, but on shelters. It's very frequent to face different kind of sexual violence, domestic violence. We have to spread information on how to prevent and what to do when these things happen. On risk communication, I read someone asking what we have on risk communication, and we do have. We use different social media. In Brazil, we use a lot of WhatsApp to send message to families, to stakeholders like municipal managers, teachers, health workers on protocols, what to do, where you can access to service, and how you can diagnose a situation that you have to call for assistance. So things like that. We use social media, but we also use regular or traditional media, and radio is still a very important way to disseminate this kind of information. And on cards, we can also share our cards, not only on smoke. This is about prevention on smoke. We distribute this card through social media. This is UNICEF website in Portuguese, in Spanish, because we are at the border in the Amazon state, and also using indigenous language to really reach those most needed of this kind of information. We have cards not only for fire, as asked, but also for other kind of emergency in all around Brazil. And last slide, when we talk about roots cause, what is causing all these? The roots cause, we cannot only respond to the emergency, but we have to go to the root cause of all this climate emergency. Our vision is to ensure the right of every child in Brazil to live in a clean, healthy, and sustainable environment, protecting the most vulnerable from the impacts of climate change and environmental degradation. We have three main strategies: adapt essential service to protect life. If you want more information, I can share with you later on what we are doing on to increase resilience, for instance, of health units in Brazil. We also empower every child and adolescent to be a climate champion, just like Kira is. And we also mitigate climate change by advocating with several stakeholders. At this moment, for instance, we have a great opportunity in Brazil. The G20 meetings is taking place in Brazil this year, and next year the COP30 will take place in Brazil as well. So this kind of momentum, we think it's very important for all of us, to the whole world, to advocate for climate change, for mitigate climate change.
Thank you
and
so
this
much.
is it. Thank you very much.
Thank you so much, Luciana. That's really important. For our final presentation, Brian, what are the answers? So what do we do now and in the future to mitigate the impacts? If you could please give any thoughts that you might have on that, that'd be appreciated.
Certainly, and yes, I think there's some really interesting groundwork laid, and at risk of repeating myself, I think there's a few things that are really important. One of them, and I think this is quite encouraging, there's a lot of investment right now in Canada and the US, and even around the world, in terms of figuring out what's actually in smoke. For example, there's a project going at the University of Toronto that says, once the smoke is released, what's in it? How does it change over time? And that gives people, a variety of people, better ways to respond if you understand what's going on. There's been a lot of advances in terms of occupational health and safety, and it's easy to look at a mask. You wear a mask to protect yourself, but occupational health and safety is now thinking about the mental health impacts for employees. But I think that spills over into the cultivating and promoting mental health in society at large, and particularly in evacuees, it's very difficult. And I think the other piece is that there's been a lot of awareness and a lot of development in terms of having better ventilation systems, having better filtration, things that we can actually do that will reduce the impact in a room, in a space, and particularly in places where children are. If you have a really good ventilation system, it can significantly reduce the PM levels, for example. But even in an individual room, something like what's called the Corsi-Rosenthal box, basically a fan and 4 filters, tape it together, miraculous change, or you can buy a commercial one as well. The other thing is there are some policy things. There's things going on in terms of reducing fuel around communities so that, in fact, the direct threat of fire, but also the ability to control fire and to manage fire is improved. And so that allows fires that are less intense near communities and better fire response. Further, you're never away from smoke entirely, but near sources are obviously worse. And then the other one, this is one of the big ironies, is one of the things that probably reduces the risk of fire is in fact prescribed burning, which of course produces smoke in itself. The thing about that is you can actually predict it, you can guess where it's going to go, and you can try and time what's happening there so that the impact on communities is reduced. But it also puts a situation where you can alert people that there's going to be smoke in the air. So if you need to go away or you need to make sure your windows are closed and you have some ventilation operating, that's really there. So there's no simple, no easy answer. And I think Kira made a good point. We have to learn how to live with fire. There's things we can do that reduce the impact, reduce the impact on communities from smoke once it's there, but also to reduce the volume of smoke by putting it out in little puffs, like through a prescribed burning kind of thing. But again, it's a very difficult thing. You can have unintended consequences on some of those. And I think the last piece is there's a bit of incentive right now. People see a fire like what's happened in Jasper and what's happened in Yellowknife last year, what happened in Fort McMurray a few years ago. All of a sudden, that's a semaphore. People are realizing, hold on, there's a problem. And it points back, gives one more card in your hand, I guess, if you like, to play that says climate change is really a big deal and it impacts us all. So thanks very much.
Brian, thank you so much for that expert view and great advice. We've received so much important information today, and I want to thank everyone who has joined us, and especially thank our presenters for joining us from the University of Alberta, from New York at UNICEF Global, from Brazil, UNICEF, and Kira joining us from Canada's North for the youth perspective. For some final thoughts, I'd like to pass it back to our President and CEO, Sevaun Palvetzian, and thank you all for joining today. Over to you, Sevaun, for some closing thoughts.
Thank you so much, Basia. I'm sure, like many of you, I was making many notes throughout the presentation. I want to thank, on behalf of the entire UNICEF Canada team, our colleagues for making today happen, but also our incredible panelists. So Kira and Swathi, Brian, Luciana, you brought such important firsthand experience and expertise to this topic, a topic which we know will only grow in importance. We're sitting here in 2024, but by 2050, the increase in wildfires will go up by 30%. So we are adjusting, sadly, to our new normal, and hopefully with some of the tips and hints given here to parents and caregivers, we can help to make sure that children are safe. On our website, unicef.ca, you will be able to find an entire compilation of materials that we use today, including the slides, which our presenters were generous enough to share with us. And there'll be a link to this recording as well, so that you can share that with any other contacts or look at it again as you're taking in this detail. I really liked what Kira said at the beginning of your remarks, Kira, where you said children are the least liable for what the state of the world is as it relates to climate change, but feel it the most in the most pronounced way. And so we are very proud that UNICEF, the world's largest humanitarian organization focused on children, has this and so many other issues top of mind in the work that we do and the awareness that we try to push forward. So again, thank you all for joining us this afternoon. Thank you for making this an important topic in your own lives and community. And if you are interested to help encourage political leaders here in Canada to ensure that children and the unique impact and the lens of children is in our climate response, there's something called the Intergovernmental Declaration for Children, Youth and Climate Action. It's a document which since 2019, about 50 different countries, including Germany and Sweden and Netherlands, have signed. As yet, Canada has not yet, and we hope to see that as a signatory to that, which conveys importance of the child lens on climate change, but also making sure that climate funding has a child perspective factored into it. Let's hope to see that leadership happen by Canada and in advance of COP29. Thank you again, everyone, for being with us. Thank you to Basia for moderating today's session. Again, to all of our panelists, and hope that you and your loved ones stay safe this summer. Thank you.
Thank you.
Thank you.